Hi friends, I am Dr. Arathi Sreedhara, consultant obstetrician and laparoscopic gynecologist practicing at Neha Specialty Clinic, Jayanagar, Bangalore. Today I will be telling you something about the most common condition called endometriosis. So first of all friends, what is endometriosis? Endometriosis is nothing but presence of endometrial tissue anywhere else apart from the uterine cavity. So let me just tell you about endometriosis. So this is the cut section of uterus. So uterus has 3 layers. The innermost layer is called endometrium, and this is which sheds out during menstruation. So this endometrial tissue, the property of which is to shed off, is present only within the uterine cavity. Suppose this tissue is present anywhere else apart from the uterine cavity, like the vagina, ovaries, tubes, which are all the pelvic organs, or it can also be present in the extra pelvic tissues like lungs, rectum, bowel, bladder. So this is called as endometriosis. So it can be either pelvic endometriosis or extra pelvic endometriosis. So what happens in women with endometriosis? So usually they will have symptoms which are very severe, which incapacitates their routine work. So they usually try to refrain from the normal activities because of the severe pain they have. Pain or discomfort with which they are present with. So let me just explain to you what exactly happens in endometriosis. So during menstruation, what happens? This endometrial tissue which sheds out can sometimes go and have something called as retrograde menstruation. So during this retrograde menstruation, what happens? Suppose it gets this endometrial tissue is present in the ovarian tissue. What happens is during menstruation, the property of this endometrial tissue is to shed off. So when it sheds out in the ovarian tissue, there is no place for it to come out and it starts collecting within. And if this collected old blood stays within the ovarian tissue, and as it does not have any place to come out, it starts forming a cyst. And this cyst is something called as the endometrioma or an endometriotic cyst or a chocolate cyst in simple terms. Many of you would have come across this term called chocolate cyst. This is nothing but endometriosis. So today let me just tell you something more when you have to consult the doctor, when you have to really panic about what is endometriosis. So let me just tell you about a few aspects of endometriosis. So now 2 to 10% of the general population actually present with endometriosis, and out of this around 30 to 50% of them are present with endometriosis during their infertility workup. So how do we diagnose endometriosis? So it is by proper history, examination and relevant investigations which help us to diagnose endometriosis. Now coming to what are the common symptoms of endometriosis. So usually a lady with endometriosis presents to us with severe dysmenorrhea. What is dysmenorrhea? It is the pain during menstruation, which is known as dysmenorrhea. What is typical of endometriosis is if it is in the severe form or if it is for a longer duration, people experience something called as triple dysmenorrhea. What is triple dysmenorrhea? Pain during menstruation, just prior to menstruation and post-menstruation. This is called as triple dysmenorrhea, and which is something very significant to endometriosis. So What are all the common symptoms? It can be dysmenorrhea, it can be dyspareunia, that is painful intercourse. Third thing, it can be dysuria, that is pain while passing urine. Fourth is something called as dysphagia. And fifth, they can also, all these symptoms can be cyclical, that is only during menstruation. Every month during menstruation, they can have all these symptoms. Sometimes this endometrial tissue, if it is deposited elsewhere apart from the uterine cavity, it is also called as extrapelvic endometriosis. So it can affect the organs like lungs also. So in such cases, what happens? Patients present with cough, chronic cough, they can also present with chest pain and sometimes with hemoptysis, that is they can cough out blood. So this, when you retrospectively take history and try to come at a conclusion, it can be endometriosis in the lungs. So like this, it has a varied presentation, and if these symptoms are recognized by you and if you see your gynecologist at the earliest, the treatments can be executed and it can be completely cured. So suppose if you go at a later stage, you might land up with surgery, and sometimes even surgeries may not be helpful if it is in a very severe form. You will not be able to get complete justice if it is in a very severe form. So how can it be classified? So like I already told you, it can be in 4 stages: mild, moderate, severe and very severe. How do I diagnose endometriosis? It's basically with all the symptoms what the patient presents with. Second thing, by using different modalities like an ultrasound. Transvaginal ultrasound is more diagnostic, or an MRI, and if required, a clinical examination also helps us in diagnosing endometriosis. And even today, laparoscopy remains the gold standard for both diagnosing and treating the endometriosis at the same time. Now, sometimes what happens, endometriosis can be associated with other conditions like fibroids and adenomyosis. So if a patient has all these three, like recently I had a patient who has adenomyosis, who has endometriosis, and that is severe form of endometriosis where both her ovaries are stuck, and she has severe dysmenorrhea. She will not be able to, not even be able to get up from her bed during the menstruation, especially day 1, day 2, it will be very bad. In spite of taking painkillers, sometimes the pain will be very bad. So this lady had endometriosis, adenomyosis and also fibroid uterus. So such cases become very challenging, and if seen early, we have different treatment modalities for all these conditions. Next, now coming to the advantages of transvaginal scan. So what happens when you do a transvaginal scan, you will be able to make out the endometrioma. The whole of the pelvis can be explored properly, and it will be a non-invasive method. But sometimes this can be inconclusive. So that is when a laparoscopy plays a role, and we will be able to diagnose and treat endometriosis at the same time. So friends, if you notice any of these symptoms in the cyclical pattern, that means during menstruation, every time, like sometimes people who have undergone a cesarean section or some other kind of a surgery, this endometrial tissue, if it is present in the scar tissue, they can also have pain at the scar, and this term is something called as scar endometriosis. So like this, endometriosis has varied presentations, and if with your symptoms, if you see your doctor at the earliest, you will be able to get the best of the treatments. So friends, this need not be managed only surgically, don't have that notion. We have lot of medical management also for endometriosis. So we usually give painkillers depending upon the condition, and then it can be also treated with cyclical oral contraceptive pills, and it can also be treated with a progesterone releasing intrauterine device. We also give some medicines in the injectable forms like GnRH analogs. So all these have given, it's really a boon to a patient with endometriosis. So to conclude, I would say endometriosis affects 1 in 15 women. But friends, if you notice any of these cyclical symptoms, please report to your doctor at the earliest, so that the best of the treatment can be adopted for you and you will be free of all the symptoms. And at the same time, many of them have the notion that with endometriosis, infertility is a challenging issue. Yes, it is a challenging issue, but it can be definitely tackled, and people with endometriosis can also conceive with the recent modalities of infertility management. So thank you once again, friends. With any of these symptoms, please see your doctor at the earliest to get the best of the management. Thank you.